Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we are taking your calls right here, right now in the studio at 866-870-5752. If you have musculoskeletal or orthopedic issues, give us a call. You can talk to Dr. Darrow. He's the guy.
That's what my mom thinks anyway.
See?
Yeah.
I knew it.
You and my mom would get along great.
Yes, where is she?
She's in heaven, looking down on us.
That's what I thought.
Sending love as always, my angel.
How old would she be today if she were still here?
Born in 1911.
Wow, nice.
Yeah, someone just dropped off my dad's birth certificate. He was born in Russia in 1906.
Wow.
And I actually had a friend of mine who was born in Russia come over and read it for me.
Oh, wow. That's so cool.
Yeah. It's a great big parchment that is really a beautiful document, and it's nice to have it in my office now. I love my dad, love my mom, great people. So let's get back to musculoskeletal medicine and orthopedics.
All right.
This is Dr. Marc Darrow. And I've been doing this work for over 25 years, ever since my residency at UCLA. And I love this work. I love watching people heal. It makes us very, very happy to do this kind of medicine. I know a lot of doctors are kind of fed up with medicine and insurance and all that kind of stuff, but we absolutely love what we do. We're outside the box, in terms of our referrals come mostly from, some come from doctors, but I don't need to satisfy doctors and tell them what they want to hear. I just tell them the truth. So our referrals come mostly from patients and things like that, because when someone heals, they send everybody. They send their family. They send their friends. And sometimes they even send their enemies.
That's hilarious.
So this, I'm gonna do a question here. Let's see. This one says perineal tendinitis. So there is a perineal tendon on the outside of the ankle. And by the way, you can type in to Google perineal, P-E-R-O-N-E-A-L. And there's a nerve, but there's also a tendon there. It's right under on the bottom, I should say, of the lump that's on the side of your ankle. Okay? And I once had a skier, a very, very high-level skier, who taught skiing, and she came in with her perineal tendon sticking out like a finger, wrapped around that area. And she said, "Do you think you can help me?" I said, "Well, I can probably help get rid of the pain, but I don't think I can help that tendon disappear and go back to being flat." And she said, "Well, I need to get rid of the pain. I can't ski." So we did an injection, regenerative medicine. This was years and years ago. And she came back 2 weeks later, and that tendon totally flattened out. Pain was gone, and she was getting ready to go skiing again, which was like her life dream, was always skiing. So this stuff works, people. I mean, I've had the worst injuries come in, things that I never thought would heal, and did. Another one that I'm thinking back that's similar is Joe DeAngelis, bodybuilder from Gold's Gym, Mr. Universe, Mr. America. He was squatting 750 pounds. You know what that means?
No.
I know, because it's like too much. And when he squatted, he would touch his butt to the ground all the way down. And he ripped out the tendon attachments to his left greater tuberosity. Okay, you guys can look up these words on Google. He had a lump half the size of a baseball on the side of his femur, what people call their hip. It's not their hip. So he came in and said, "You think you can help me?" And the same thing. I said, "Probably help you get rid of the pain there, but I don't think we can get rid of that lump." And I put a needle in there to inject it. It felt scratchy, like bone. We did 3 treatments, 2 weeks apart, came back, and that lump of callus was totally flat and gone. He was pain-free, and he went back to doing squats again. Does it always work like miraculously like this? No, nothing does. But the nice thing about this, it's very difficult to hurt somebody. It's a very conservative treatment, injecting platelets or stem cells. Very simple. I like it because it's simple. I can put an ultrasound on it and see what's going on. This is the type of ultrasound that's like a camera inside the body. You can look inside. Very easy to use. We have 3 of them in the office. They're on little tables. We wheel them around from room to room. And it's very easy to look inside the body and see if there's any pathology. It's not the only way to diagnose, because the hands are most important, but we use it to help guide the needle also. So you can actually see the needle going to the target space. If you have someone, for example, injecting a hip or a knee or a shoulder without ultrasound, I would say there's probably 30-40% chance they're actually missing the area that they want to inject. That's a big problem. Anyway, this question goes on. I diverted myself there. The person says, "Have an ankle inflammation condition, and podiatrist called it peroneal tendinitis. First went to physical therapy 5 to 6 months, along with taking a medication, meloxicam, for pain and inflammation. Still not any better." Well, to me, why not fix it? Why not regrow the tissue? Why not regenerate it? Why not use stem cells or platelets from your body and actually heal it up? Why, these other things may be great. Meloxicam is not something great because it blocks the inflammation. It's an anti-inflammatory and actually blocks the healing. You can feel better for a while, but it blocks the actual healing. The way God made the body was to heal itself. So inflammation is the way the body heals itself in the musculoskeletal system. In my book on prolotherapy, a very old book, it has diagrams of inflammation and showing how the body actually needs the inflammation to heal itself. So, let me go on to another one.
Do you want to give the phone number again?
I do, but at first I have to clear my voice. I'm talking too much.
Okay, I'll give the phone number. It's 866-870-5752. That's 866-870-5752 right here in the studio. So you can speak directly with Dr. Darrow, and you get the free book today, Dr. Darrow's latest, Stem Cell and Platelet Therapy, Regenerate, Don't Operate.
And we're going to mail it out for free if you call us now.
It's free. No postage. Free.
We pay the whole thing.
That's
People
right.
like free. And also free. Call the office. You get a free consult with my staff. And the number there is 800-300-9300. Should I go to shoulder pain here?
Yes.
Okay. That's short and sweet. This
and
comes
we
in
have a call
from...
coming in, so that you have time to do that before the call comes up.
Well, thank you for letting me know that, Nita. I'll be watching for that.
Oh, maybe not.
Maybe not.
Maybe Louise is right here right now. Yep, she sure is.
All right. Louise, are you rolling in from the estate?
Hi, Dr. Darrow. I I was at your place on Wednesday getting a shoulder treatment.
Okay.
And I just wanted to tell people how wonderful the experience was.
Wow.
From the staff to the doctors, Dr. Grove is wonderful. You were
Isn't he?
wonderful. I met you there. To drawing blood, to injecting. I got to see the ultrasound of the inspection. I got to see the ultrasound of the injection. It's so fascinating. It's basically pain-free. And the next day, I mean, I was fine. I'm going to go back in 2 weeks, and you guys are going to check me out. But wonderful experience. Wonderful.
Louise, do you need a job working for us?
I just want to thank you.
Well, God bless you. I appreciate the kudos there, as they call it.
Yes.
Most people have an amazing experience with us because we're a happy team. And tell us about Dr. Grove's personality, because he's unique.
Oh, he is wonderful. He's so engaging. I mean, I'm someone who has a million questions. He entertained every one of my questions in detail, which is so nice to have a doctor do that. He's a personable guy. I think he's young. I'm not so young, but I think he's young, and he's got great experience and just a wonderful person, great bedside manner, if you will. Wonderful.
Well, I'm so grateful to have him on staff. As my listeners know, my hands have been worn down after injecting all these years, and I have trigger fingers, which hurts to inject. So Dr. Thomas Grove is now my injector, and he's been trained literally better than any person on the planet. He's been doing this work for a dozen years or so, and he's had the best training that there is. And I am so confident with him. When I brought him on staff in August, I was in the room with him, showing him how I do things, and then he started doing it. I was watching him, and then finally one day he says, "Okay, you don't need to be here anymore." Yeah. Tell us how he looks.
How he looks? Oh my gosh, he is. He obviously works out at a gym many times a week. Very buff, very muscular, very healthy. The spitting image of health.
Yeah, he really is. I don't think he's ever been sick one day in his whole life.
Well, I'm envious.
He's one of these superhuman beings. Handsome dude, fun to talk to.
Yes.
He was the captain of his football team in college, and he just really knows how to deal with people. So, Dr. Grove, I'm wearing a hat. I'm going to take it off to you. And awesome. I really love the guy. That's all I can say, and all the patients love him too. He's got the best personality of just about anybody I've met my entire life.
Yes.
And the best
Absolutely
hands.
Wonderful.
I mean, he is just the best injector I've ever seen.
Yeah.
Anyway, I'm so glad you had a great experience, Louise.
I'm sorry?
I'm so happy you had a great experience with us.
Yes. I just want people who are listening to the show to know that. Don't be afraid. There's nothing to be afraid of. It's just easy peasy, piece of cake, no pain, wonderful.
Well, God bless you, Louise. I appreciate the call-in. And
you got it. Thank you.
Next
Bye.
time you come in, I'll spend more time with you.
Thanks, Louise.
Thanks, Louise.
That's
wow.
awesome.
I'm lifted.
Totally. I'm even lifted.
Yeah, that person, Louise, I mean, she sounds like a lifter, right?
She's very energetic and very positive.
In psychological terms, since you're a psychologist, Nita, what do you call a person like that who just lights everybody up?
Well, there's all kinds of things we could call somebody, but the energy that you feel off of her, we just felt lifted up. It's just part of her personality.
Yeah, she's a light bearer. I call them light bearers.
Oh, that's a good one. I like that.
Yeah, they walk in the room and you feel good.
Yes.
So I'm going to go to another question after we give out the phone number. This is Dr. Marc Darrow, And the show is Living Pain Free. And it's all about stem cells and platelets, which is now called regenerative medicine, and how to heal your pain in the musculoskeletal system, neck, back, fingers, toes, arthritis, hips, shoulders, knees, ankles. Doesn't really matter where it is. If it's the musculoskeletal system, we can usually help. Very conservative procedures. You walk in the office, you get injections, and you walk out. You can drive yourself. You don't need anyone to drive you. There's no anesthesia needed. There are some people who are, needle phobic, and we can give them some Xanax to chill them out. If they do that, they need to have a driver because that sedates them a little bit, takes the edge off. I actually had one guy come in, and I offered him some. He said he was needle phobic, afraid of needles. And I said, I'll give you some Xanax. He goes, no, I don't want that. He says, have you got any alcohol? And I did. I had patients sometimes give me like tequila or something like that. I'm not really much of a drinker, but I keep it in my office. And so I gave him a few shots of tequila, and he loved that. And the procedure went very well for him. So the phone number to the studio right now is 866-870-5752. You can call us right now, or you can call the office and get a free consult with my staff and a free copy of my book if you call the studio or you call my office. And the office number is 800-300-9300. You can also email me. And to get to the email, it's on every page of my website, www.jointrehab.com. So this is a question on chronic
Okay, but we have a caller, Donald in Sylmar.
Okay, let's do that. Thank you, Nita, for being my eyes.
You're welcome.
Okay, so Donald, this is Dr. Marc Darrow. How are you today, sir?
I'm surviving. I'm 86 years old.
Well,
Wow. Good for
what's
you.
wrong with that? That sounds pretty
I'm
good
just
to
saying,
me.
I'm assuming when you get older, you get all kinds of problems. That's all I'm saying.
Well, some people do, some people don't. Some people are young and get problems, you know. Some people who are older. I don't know what older means these days because you're 86 and you're still kicking pretty good.
Well, I've just got a lot of pain. Mostly, I think it's mostly the back and the rotator cuffs. But
Okay.
I use a walker. And I'm afraid of balance. I'm afraid of falling. I've fallen 3 or 4 times.
Okay. Donald, have you ever gone to physical therapy for GAIT training, G-A-I-T?
I can't hear it. Just Gates, you said?
GAIT, G-A-I-T. It's ambulation training. It's how to fall.
G-A-I-P.
T, like Tom.
Well, I've had physical therapy, but I don't know what Gates training is.
It's a training to teach you how to fall without breaking a hip or shoulder.
Well, that sounds like an interesting subject, but I have to plead guilty on that one.
I would, next time you go to physical therapy, tell them you want GAIT training. And they teach you.
G-A-I-T, GAIT.
You got it. So they teach you, if you're going to fall, then they teach you how to roll with it rather than to fall with an impact.
Okay.
And then they also, which is just as important, is they teach you recovery. That means if you're on the ground and you're what I'm going to call elderly, I don't know what elderly means anymore, but more frail, and you can't get up, they teach you how to get up. Because there are people that die probably every day in their house after a fall because they can't get up to make a phone call to get help.
Well, it happened to me.
Well, you're still here, so you made it. God bless you.
Well, I know, but just barely. I couldn't reach the phone. That was the thing. I couldn't reach the phone. I'm thinking of getting one of those emergency call buttons around your neck.
I think that's a smart idea, but I think it's also smart to next time you're at physical therapy, ask them to teach you how to fall and how to get up,
Okay.
and then how to strengthen the muscles that'll help you get up.
Okay.
I mean, I don't care who you are. You could be, Arnold, the bodybuilder. With aging, the muscles decrease. We get weaker. We become more frail. The bones become osteoporotic. And I don't care who you are, that's just a natural part of aging if you live long enough. So I do treat people who are 100 years old, not too many, but I have treated several. I treat tons of people in their 90s, lots in their 80s, and I actually treat children. We get a lot of young athletes that come in. So age has nothing to do with repair of tissue. We can repair tissue on anybody.
Okay.
So you mentioned that your rotator cuff is bothering you. That's an attachment, a tendon that attaches to the shoulder. And are you able to lift your arm up in the air?
Well, I mean, yeah, except in certain places, and I got to do it slowly, of course.
Okay. Well, if you're
certain
using
areas, it's tough. Yeah.
Sure. If you're using a walker, you're going to be stressing your shoulders, and then my job with you would be to repair the area where you're having tendinitis or a tear in the shoulder.
Okay.
So we get that a lot with people in walkers or wheelchairs. You know, the shoulders are just going to wear out. But that doesn't mean they can't be repaired. So when you have a car that you love and you've had it for many, many years, you don't throw it in the trash, in the dump. You repair it, right?
Yes.
We have things called classic cars.
Yeah.
So at the age of 86, you're moving into the classic phase, and you need maintenance, just like a car that you love.
Uh-huh.
And that's what we do. We use stem cells or platelets from your body, and we inject it, very simple. Come into the office, we draw your blood, we inject it, and you walk out.
Is there any risk or anything like that?
Well, there's always a risk of anything, right? The main risk with the thing we see with patients when we do this is they get stiff a little bit afterwards. The risk of infection is the same with any injection. It's very, very, very minimal. It's possible theoretically in some parts of the body to hit the lung, to hit a nerve. Thank God that's a rarity. But the main thing with you is you'd feel a little stiff most likely for that day or to the next day.
Okay.
Any other questions you have, Donald?
Well, just what to do and how to do it and how much it costs. I guess it all boils down to that. How long do you have to do it for?
The best thing for you to get the little details like that is to call 800-300-9300. That's our office, and they'll give you a free phone consult right on the phone.
Okay.
Donald, I hear that fancy banjo playing bluegrass, so it means the show is over. God bless you, my friend. I can't wait to see you. And for those of you that want to call the office, it's 800-300-9300. If you want to email me through the website, that's www.jointrehab.com. We love you all, and we hope for a quick healing. Thank you, Nita and staff. God bless you.
Thank you.
You've been listening to Living Pain Free with Dr. Marc Darrow. And now that you've heard Dr. Darrow, call his office at 800-300-9300 and speak to one of his joint rehab experts for free and ask for a copy of his book, Stem Cell and Platelet Therapy. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.